My name is Leah. I am a drama teacher who has been teaching for the last 12, almost 13 years. I've traveled a lot and always been fairly able-bodied, which is why the last 3 years have been so exciting. My journey with the Canadian healthcare system started about 3 years ago when I noticed a lump. And like most women, I perform exams regularly, so when I saw one, I went to my doctor, who referred me to a gynecologist. And just getting that appointment took several months, going through the bureaucracy and the hoops of trying to get to the gynecologist in the first place took about 6 months. After I was diagnosed with PCOS, I was sent home to essentially lose weight and was told by multiple doctors that I'm just too fat. If I go home and lose weight, I will fix all of my problems. What was unaccounted for is that PCOS and endometriosis make it very difficult for people to lose weight. So I went home and was gaining weight and becoming sicker and sicker and sicker until I started visiting the ER. The first time, the doctors told me it was a panic attack. They gave me some beta blockers and sent me home. The second time, they started to get a little bit worried why I was coming in and out of the ER. I think it was about 4 months in between. This time, they recognized that my body was fighting some sort of infection, so they gave me antivirals, or antibiotics, and sent me home. The third, the fourth, the fifth times all looked very similar. Roughly 24 hours in the ER. I would go in complaining of extreme, intense abdominal pain. Abdominal pain so intense and so tangible, I would throw up. Just sitting there, light hurt. I was nowhere near functioning. And they would tell me that I was constipated, that I was having gas, that I should go home and try to take some Tums, see how I feel, and I'll probably feel better in the morning. That happened roughly 10 times over the course of 2 years. It wasn't until this April, having been in the ER in November, having been in the ER in January. In April, I was in the ER for 4 days. And in the Richmond ER for 4 days. They did not have a bed for me, and despite the fact that I was bleeding internally, they could gauge that I was hemorrhaging. They did not know from where. They simply knew my abdomen was filling with blood. I was suffering from some sort of infection. I probably shouldn't go home. We'll keep you here, but we don't have a bed. Just hold tight in the ER. On the fourth night, I asked if I could please sleep in the psych box because there were people having mental health crises, other people in the ER visiting loved ones who were having very real emergencies. And I was on day 3 of my ER visit, so I slept on the floor of the psych box with the door sort of half closed. And on the morning of the 4th day, they said, "We don't really know why you're bleeding. You're still bleeding, but there's nothing more that we can do for you." And they sent me home with more painkillers. And that will be the 3rd or 4th time in 3 years that I was sent home with some painkillers and a prayer. It was that time that my gynecologist listened. And it was that time that it was so emergent, not that she heard me, because she had listened, she had heard what I was saying. She was legally able to do something. It wasn't until I had almost died, that I had an infection and my body was shutting down, that the Canadian government could step in and do anything to help me, that medical aid could be provided at all. From there, it took another month and a half just to get into the surgery room. A month and a half from being emergent in the ER, bleeding internally and not receiving care, to a month and a half of being by myself in my apartment, still trying to work full time because I have a job, waiting and counting down the days to this large surgery which was going to have me out for several more weeks. Because of the nature of my endometriosis, they needed to have a secondary team involved. There's only one of those doctors at the hospital I needed to go to. They weren't available the first day. It had to be moved. I'd moved all my work. All of my work has to be moved around. I'm now losing money, time, money, valuable resources as an adult. Now I am coming through to the other side. I'm no longer in pain every day. Wonderful bonus for my life. But this is still a constant thing that I will have to deal with. Endometriosis doesn't go away. PCOS doesn't go away. I will continue to have to seek care from the Canadian medical system. And as I exit what is quite a traumatic period in my life, I am forced to consider how I need to protect myself for the next round of surgeries. The ways in which I need to gather my documents and get the scans and the copies that were not given to my doctor from all of those ER visits. I need to consider how to protect myself in the future by gathering that information for myself now, because I know that my journey with the Canadian healthcare system is just starting. Absolutely. Through the process of getting diagnosed, there were many delays that I experienced. Not just the delay in getting to the gynecologist and the specialist that I needed to see, but then waiting for tests and blood tests. Often the tests, you need to reach a certain threshold to even be eligible to get the tests. So I found myself waiting for my condition to worsen so that I was eligible to get the tests to prove I had the disorder we knew I had to get the treatment. The day of the surgery was very smooth, and I was very lucky to have been gifted a surgeon who was incredibly explanatory. She told me everything that was going to happen, all of the risks associated, as much information as she could, and she was still unable to give me all the information that she should have. Because of the information she is required to give and the series of things she has to do before she could improve or increase the treatment that I was getting, she would say a lot of things like, this is what's going to happen unless this other thing happens. So I was given as much information as was possible, but because of the constraints of the surgery team, I was not able to get all of the information that I would have wanted because there were all of these additional what ifs, maybe this, or what if this changes, that we couldn't really account for in the plan. After surgery, I was sent home to largely take care of myself. As it is with many small surgeries, because what I had was a laparoscopic surgery, 3 or 4 very small incisions into my abdomen. My support system was my family and my friends, and they relied before that on me having family and friends, which I do not have in Vancouver. So I had a really strong surgical team, but the care prior to and post surgery from my actual medical care team was lacking. Absolutely not. I do not believe that the Canadian healthcare system is equitable or accessible for the vast majority of Canadians. The wait times are too long, and the additional costs of some of the medications that you do need to pay for are prohibitive. The condition that I have, on average, women in Canada wait 7 years for treatment. I was incredibly lucky and only had to wait 3. I am a white woman. For women of color, Black women, Indigenous women across Canada, their pain is dismissed at alarmingly high rates, and it might take them twice as long to be heard. It is nowhere near equitable, not at the state it is currently. I think a large problem that many people face in different ways are the biases of the internal system. The doctors, while they are trying to do their job, all come with their own baggage and their own background. And respectfully to a lot of those doctors, that background can prevent them from doing their job properly. So while we need to overhaul the whole system, I think a very tangible thing we need to start to fix immediately is how internal biases affect patient care. When I went in for my surgery, I was in a room with a family. There were 3 women in this family, all had endometriosis. And of those 3, 2 of them had opted to fly home to India to pay out of pocket for their surgery rather than wait years to be seen in Canada. And I think if that is not an indictment of the current state of our system, I don't know what is. Before I lived in Canada, I lived in the UK, and the UK has universal NHS, universal healthcare, and through the NHS was able to receive not dissimilar treatment, but received and experienced the same dismissive behavior from some doctors that I received here. Often men, often male doctors who were looking down on my pain as a woman, assuming that I didn't understand what pain was because I was a woman. And while the NHS is also a fantastic system, it is also flawed, and the doctors are experiencing a lot of the same burnout that they are here. You can't treat someone in 10 minutes. You can't treat someone in 15 minutes. You can't look at my body in 15 minutes. So how is a doctor supposed to do their job or their due diligence by their patients if the system is so strapped and so tight that they cannot even have the time to look at their patients, let alone actually provide them the treatment? Before that, I also lived in China. Spectacular. You go and you pay for your healthcare, you can get whatever quality of healthcare that you want. Spectacular healthcare. I got x-rays done in a single day. Tell me where in Canada I could go in the morning and have x-rays by 6 p.m. Not a place, right? You can get all the cold pain medication you want. What's your problem? You got a knee ache, a lung ache, a cough, a sniffle? We can find you something and give it to you because there is no bureaucracy standing between that. It is simply, can you pay for it? No? Then we'll give you the slightly less expensive option with the no-name brand, that there's still an option for you. But the system, you have to pay into it for a lot of it, and that out-of-pocket payments can be really inaccessible for a lot of people. So 18 hours in the ER, I am on all kinds of painkillers and anti-nauseas. I am still in pain and still throwing up, and a doctor sat down in front of me, looked me in the face, and asked, "What do you want from us?" "Well, doctor, some help would be delightful. Please and thank you." But when it is a reproductive disorder, when it is something that is affecting my ability to have and carry children, it's this idea that, A, this is a later problem. I was told by several doctors, you don't need to deal with that now because that's not something you're worrying about right now. What? So I should go away and let my internal systems degrade and fall apart and become more damaged because every day, every period, my uterus and my ovaries become more damaged and less likely to function. But they told me multiple times, that's a next year, that's a later problem. Go away, come back when it matters. It shouldn't matter what my personal goals are today or tomorrow. My body matters, and my functionality matters. My reproductive system is not simply there to house babies. It has other poignant, very important factors in my body. I would love to continue to produce estrogen and progesterone and testosterone and continue to have regular hormonal factors in my life without drugs. But they were very, very happy to send me away and to continue to let me break down and degrade to the point where I would have needed those drugs, not to have children or do something magical with my life, to live, to just breathe and function every day. Surely it would cost the Canadian healthcare system less to help me initially and to give that care when it is initially required, rather than tell women to wait and wait and wait and wait to the point where their systems are no longer salvageable. Or, as was my case, immense amount of damage was done to the other systems because I was put off with care for so long that it damaged other parts of my body. And that was simply because they waited so long to provide the care. I was sent home from the hospital bleeding and hemorrhaging so many times that the internal systems around the one that was damaged now have lifelong lasting damage to them. And the healthcare system will have to deal with that at some point. I will have to deal with that at some point. But not today, so it's not their problem.
Just outside of interview, but are you okay?
I'm good. Yeah, I'm okay, Iris. Thank you. I am okay. Yeah.
It's mind-blowing.
It's a very frustrating system to navigate your way through.
Yeah.
It is a very difficult system to find gratitude in. But I am grateful. I am grateful to have had access to universal Medicare. I would not have had the health care that I needed if that had not been there. Women in the States right now are fighting for basic healthcare rights, basic reproductive rights, let alone their healthcare rights. And I am immensely grateful to have had access to a system that did save my life. That system is broken. The doctors and the nurses are telling us it is broken. The patients know that it is broken. And we need to overhaul the whole system, not just for the benefit of the patients, but for the benefit of the people who are working in the system and who are being burnt out and broken, trying to make a system that does not work, work.